Much, Veronica. Thank you, all of you, for everything you do out in the world to support our students and our communities. John and I are honored to join you today to share a new tool. I want you to think of it as a little gift in a box with a ribbon and everything. So we're excited to share it with you. One thing I would like to invite you to do as well, I see many of you greeting us. Thank you so much. Please, if you would like to get continuing information about our program, and we're going to be adding to it, and I'll tell you about that in a minute, please put your name and email in the chat. We will be sure to add you to our list. We certainly will connect through Veronica, but if you have additional information requests or just want to stay connected, please put your info there and we will do the same throughout. John and I are both presenting. He's on mute because he is joined by his co-presenter, his cat Chloe, who is very not happy about being in the room with him during some home renovations that are happening. So please be patient, he is there. The way we're gonna flow this is a quick introduction of us and our roles, how we came to create this tool, this little gift, and then we'll do an overview. John will then show you a little bit of a demo. The tool is built in Canvas, and we'll explain why in a minute. We'll go through a couple of examples and tell you where our next steps are. It's already evolved every month since we first launched it last December. And then we'll have most of the time for questions. So if that sounds good to you, we'll go ahead and roll with the Infection Control for All Now ICAN Safe Workforce, Safe Workplace program. First, let's start with who are Joy and John? So many of you may know in the Workforce Economic Development Division of the Chancellor's Office at the California Community Colleges. We work with all 115 colleges broken into these priority sectors. John leads the Health and Health Workforce Initiative, and I lead the area that's the Retail, Hospitality, and Tourism sector. John actually has regional directors in every single region across the state. In our sector, we only have 4 that are priority regions, but we know that the retail, hospitality, tourism sector is kind of very important throughout the state, about 25% or more of the employment pre-COVID. So why I'm telling you this is our job as statewide directors, it used to be called sector navigators, is to really find ways statewide to build student success, support employers, showcase our California Community College resources, and in this case, really find ways to support economic recovery and community recovery. This past year has really brought up forward an opportunity for us to come up with ways to build accessibility to tools. You know, in college, we always think of ladders, right? We want to get them on a ladder and build that education pathway. Well, some people need a step ladder to get to that first rung, and some people need a rope ladder to get to the step ladder. And so in this case, we really wanted to make the tool we've built an example of one of those lower rungs to maybe get onto this educational pathway. We are excited to collaborate, and we'll tell you why. John is an amazing leader who has just done 1,000 people's work last year in coordinating all of the demands of the health sector. So we're going to talk to you a little bit about our backgrounds and how we came to work together on this from different needs. So I'll let John tell you kind of what was driving his thought, and he's a public health nurse. So he's really a practitioner in this area.
Thank you, Joy. Can everybody hear me okay? So I apologize if Chloe starts acting up and she's not very happy being in the same room with me today, but hey, that's what happens. So thank you again for joining us today about this webinar in ICAN. And I think what really resonates with me is that we're able to share information from what we get in the healthcare training and what we do in workforce development. So one of the things that we look at in healthcare, you know, we do training all the time on infection control, working in hospitals, working in skilled care, working any kind of medical provider, you have to understand infection control. You are continuously looking at best practices for infection control. We know what we're doing. We know what we're using disinfectants for. We know why we're wearing masks when we're have to wear masks, and personal protective equipment, PPE. So, during this whole pandemic, we had this whole entire uprising where, the sheets were just pulled out from under us, and we had to look at how are we going into this new normal type of phase of wearing masks in public and having to wash your hands and sanitize things that you use. And it's uncommon now. It's not common as common now that we're actually now sanitizing groceries as we bring them into our own house because of people. We're not sure, who's actually touching the products in the store. So our normal has changed to what we call a new normal. And I hate calling it a new normal, but it's just a way of that we are evolving as how we have to now protect ourselves. So in that, like I stated with healthcare, we have traditional training models for how we learn about infection control in all of our nursing and allied health programs. And that's really embedded into what we do as far as our standards of practice and care. With this pandemic, things kind of came up, and it was kind of like the last day of school when you're walking out and you throw all the papers up in the air. That's what kind of happened in this pandemic, and no one really knew what to do. My colleagues, even in public health, were calling me and saying, "What do we do?" And I'm like, "You're the public health officers. What do you mean? What do we do?" So it came to a point where we really had to look at, what do people know and what do people not know. And so, because in our programs for allied health and nursing, we actually already put this into the curriculum. The students come out with this and understanding and knowing that. That doesn't mean that other sectors do not do infection control or talk about it or teach it, but they teach it in a short scale. They teach it into just really rudimentary type concepts. And so what was kind of looking at and understanding is that they're having to now change their practices, those who worked in retail, those who work in hospitality, on doing different things. I mean, hotel staffing will have to now wear masks that they wouldn't normally do when you're cleaning a room, and having to, disinfect and clean every piece of furniture, lamps, even the switches to turn on the lamp and things like that in the rooms. Some rooms were even being flagged for 24 hours so that they know that room was clean, and it was, but did they understand why they were doing what they were doing? Did they understand why you needed to put on masks? So part of that came out with this ICAN, is to look at how do we prepare the non-healthcare workers with information that's fundamental in nature and easy to understand, but to give them a little bit more insight. So, we collaborated, Joy and I collaborated, and a lot of this was driven from industry, from the retail hospitality side, that really said, we need to have a better understanding of infection control practices. We need to have our employees understand why they're doing what they're doing, that they're not just doing it, but the reason why. And so that's where this actually came and evolved. And I was very happy that this kind of collided within our scope, because it was able for us to be able to share information that we have in healthcare to other service areas. The evolution of this particular thing has merged from, I think, 3 modules to 7 now modules within the and we'll share that a little bit more in a bit, but it's actually expanded and grown because of that. And we got a call yesterday saying, well, what about educators? And so we're going to expand it even more, and we're continuously updating, as Joy mentioned. We're continuously updating to current standards and current practices that are happening, so that we can make sure that the knowledge is relevant to today and what we're doing.
Yeah, and I'm really grateful, because it was John's desire to make sure people stayed safe. I mean, I met John 2.5 years ago, and the very first thing he said at our first public meeting after he introduced himself was, "I'm John Cordova. I'm the statewide director for health. Wash your hands." And now he says, "Wear a mask and wash your hands." He always said that. And now I love that we're all like totally, dude. No, you wash your hand. So what I come from, my background is in teaching at the college level, but also many years in retail, hospitality, tourism, human resources, and training and development, and in operations. And the first thing I thought was, man, if I were head of people at my old company, I need a tool. I can't just send them to the CDC website or give them a checklist or give them a link and watch this video. I know when people get that, they play the video and then they're going off and doing the dishes or something. I don't know if they actually learned it. And I have no way to protect my company to document that we've actually trained these folks, right? So for me, it was a combination of if I were an employer, I would want workforce training. I'd also want to share this. That's why we made this logo on purpose with community college colors, but also with this idea of it's kind of the good housekeeping seal of approval. So we made a digital badge, but we also made it so that, oh, John, by the way, I think we're going to do funding for some window clings. So our partner businesses that can have this can actually put this in their storefronts. But to build consumer trust and confidence. I live in San Francisco. There are a lot of mom and pop shops, but open little stores. If they use this and their employees use this, then I feel better about going in there as well. And one other thing that we really want to do was sort of that HR tracking and documentation, which I think is hopefully useful to you and your folks in your world, but for employers for sure, knowing that I can see there's a test to get this little badge. They've passed it. They can take it multiple times. This is all really useful data. So that's the overview of how we got here. Let's just tell you a little bit about it, and then we'll dig into kind of the benefits for all sides. We built it as a free certification and training. When a person completes it, they have a digital badge and they get emailed a certificate as well. It takes no more than 2 hours to complete. That was, again, as John mentioned, we worked with industry partners to develop each of the pathways that you'll see. So the content actually comes from companies that are in practice. The content that was built into the infection control part is CDC, so and CDPH based. And John, as he mentioned, he does review it. It was originally built with an epidemiologist's input, and so it is the correct information. And we tested it with multiple kinds of mobile tablets. So mobile phone, not just a laptop, but a tablet as well. It is live. You can go there. So that's the website to go to. Let me talk to you a little bit more about what we're finding. For employers, they're excited that their employees can be trained without any access from them. They just can send them the link. They get documentation of training. And here's why we made it like this. So if you think of how hard it is to apply to college, we try to make it the opposite of that. So it was a free, completely accessible thing. When you completed it, you got your certificate. That's it. There's no strings attached. But what we found is that the retailers or the partners we found who are like, what else do you have for us? All of a sudden, they are interested in what resources the community colleges can bring to them. And that's what we were hoping, is that they would really see this as a gift and show customers that they're safe is a really big thing, both digitally as well as in person at this place of business. We built it into Canvas because Canvas is what most colleges use. So again, we talk about that little rope ladder or step ladder to college. They now see they can do a course in Canvas. They're very bite-sized pieces. John's grant is able to host it at SynEd, which is a nonprofit. And so it's easy for new workers who are thinking about maybe getting more training or going into more education. They understand Canvas now. It's a tool we've now taught them just by giving them this, which hopefully will also make them more employable. For adult learners, and this is an example of an update. When we first launched this person was the Surgeon General. This person is no longer the Surgeon General, so don't worry. This is not what you'll see when you go into Module 1. We actually have the new video of the 5 living California governors talking about why you have a responsibility to be safe. That's how dynamic this thing is. I didn't change that slide from 2 minutes ago. The modules are short. There's a lot of video, a lot of photos, and it can be completed on many different kinds of platforms. So computer, mobile, or tablet. We also built things like flashcards and check learning as you go. There's a little quiz on each after each little bit, so you don't feel overwhelmed by this is too much information. And as I said, we have relevant industry information built in. We have examples of toolkits, CDC infographics, things that people would actually find useful when they were using this at work. We originally started with the 5 certificate pathways you'll see in this first line. So I'll explain that in a minute, but basically it was really in response to hotels and restaurants. And then just recently we've completed a distribution center pathway. So a warehouse worker can take this and show that if they want to apply for warehouse work, that they have actually already completed this and they're even further ahead than other people who are applying. And I believe by next week we'll have this retail customer service pathway. As I mentioned, somebody mentioned earlier, the educator pathway, I expect we'll see an 8th one here, hopefully within a few weeks. I have told people, if you are interested, because we did have a principal, Tammy, I think was her name, John, on one of our webinars. She was an adult ed principal, and she said, can I use this? And I said, yes, absolutely. Use the engineering and maintenance pathway and a housekeeping pathway for your support staff on campus. And then we're working on kind of the educator instructor pathway would be the next thing. But in the meantime, if you have staff that are trying to keep your campus safe, those would be the 2 I would recommend that you could use right away. So we have these pathways for digital certificates, digital badges or certificates, and we have 5 modules. And the reason I mention that is, as John mentioned, these first 4 modules are the CDC, CDPH information. And then at the end, you get to choose a certificate pathway. You choose which of these you're going to take, and there's specific occupational or workplace stuff about that particular pathway. And then you get to take a 10-question quiz. And if you can take it as many times as you want. I think you have to get 7 right to pass. And then you'll get that certificate. Also, if you want to go back and do another certificate pathway, you don't have to do the entire thing again, but you can do as many of these as you want. And the thing that we're excited about, which you've probably figured out that we've built on, because those first 4 modules contain the bulk of the health information, it's very scalable. We can add occupations, as we're just talking about. So we've already added these 2, and we can work with other sectors to collaborate and continue to build as we see that need. And obviously we mentioned educator pathways, kind of the high priority. 2 quick slides, and then John's going to show a demo. I see a lot of questions coming in, so keep that going. We will get to those right after John's sharing. There are a couple next steps. As I mentioned, sharing with you, sharing with other educators, but also building the educator pathway. And then this morning also, we were able to secure the funding for us to be able to translate this to Spanish. So that is our next priority. So the existing pathways to all be translated into Spanish. And I can't give you a time frame on that, but it's going to be light speed compared to regular community college time, which means this year, which also means hopefully by April, April of this year. Okay, so I'm gonna stop sharing for a second, and I'm gonna let John take over with the demo.
Okay, can you see that, my screen?
Yes, we can.
Okay, I couldn't hear anybody. So here is the student version of the module. So when you actually log into it, you'll see the home page is ICAN Infection Control All Now. And so they'll see the general information and the information related to why the training's here, training objectives, and then the overview of the course. And as Joy has shared with you, we have the main 4 modules, which kind of have a little bit of time that's allotted to them. Again, we made this for up to 2 hours of time. This could take longer. People can stop where they're at and come back. It's a self-paced program. It doesn't necessarily time them out at any point, so they can always come back to where they left off. It's just a matter of when they complete it, then they'll get the certificate or the digital badge. But otherwise, the timing is just an estimated timing of what it takes to complete each of those modules, so that they can actually do it in various sittings, or do it at work when someone gives them time to do this. So we have the 4 major modules, and then the 5th module is actually going to the specific pathways. And as Joy was sharing, we have the 7 now. We're going to be expanding another one. And then hopefully, as soon as we can get this up in Spanish, it'll be made available in Spanish. We made sure that it was mobile friendly for students to access it on various platforms. So it was really great to have students practice using it on their phones, their smartphones, their iPads, their tablets, and everything else, because we wanted to make it accessible in any way, shape, or form. Again, this is just a general Canvas. If you've seen Canvas, it's just a general Canvas shell. You'll see the copy of the modules here. Each of the modules will have the sections. And so we'll look at module 1. And module 1 talks about the essentials for safety and well-being. And this is why the training is essential for your safety and well-being. So we want to make it sure it's not only just for why you're doing what you're doing for others, but why you're doing what you're doing for yourself, and making sure yourself and your family are safe as well. Preparing to stay informed, and then we have a check for each one. So each one of them has a set of questions that will a question bank that they can actually answer. The questions are based on the information that they just reviewed, so they shouldn't have any problems going back and looking at that. And then the questions at the very final quiz, the questions will come back and refresh for the final portion of it, to get their badge or their certificate. This is not a certificated program. It's not a certification of any sort. We're just giving a certificate of completion for attending, for doing this, and the digital badge is an option. So a lot of people still don't understand what digital badges are in our workforce from the entry-level workers. So most of them don't apply for a digital badge, but their certificate will go to their email. One thing I think we may have failed to mention is that when students actually go to enroll into this course, it's best that they use their non-EDU email. And the reason is, if they're going to go for the badge, the firewall for most of the districts does not allow the badge email to come through. And sometimes it goes into spam mail, junk mail, but sometimes it's just blocked and not able to access. So we encourage those to use the non-email, Yahoo, Gmail, whatever other accounts that they have to have access to this. So again, this is like module 1. We have module 2. Because the timing is a little bit different. There's more content here, more information for them to have. Joy shared with you they have flashcards. We have a lot of embedded videos for them to review and look at. We wanted to make it as interactive, excuse me, so that it's not just reading content and looking at stuff, but it's really interactive for the end user. And as we mentioned, we are continuously going back and updating information as things change every day within this whole pandemic and the process. We want to make sure. One of the things I do want to state is that, yes, this was an outcome due to the pandemic of COVID-19, but we made this relevant to infection control in general. So I want to make sure that that's understood, that there is some references to COVID-19, but it's an overall infection control in a very small piece. So think about, I can teach infection control for weeks and weeks and weeks, but in this instance, we're just trying to get them to understand, why are you doing what you're doing in the current state where we're at. So that's what we're looking at. think that's it. And then you go down to your, when you get to pass module 4, you then choose your certificate pathway, and you get to choose one of those 7 pathways. Once you complete that pathway and get that certificate in that particular pathway, you can come, the student can come back in, and then they bypass all the 4 modules, and then just go to that next pathway if they want to complete a different pathway. So they'll get a,
Oh, yes.
badge. You'll get a badge for the different pathway.
That was actually one of the questions that came up. So once you're already in there, you just go back to that module 4, exactly as John said. So
this badge, it'll be this module here. It doesn't allow me because I'm not actually doing it, but if I've done this one, then I can actually go click this one and complete that pathway.
one thing too, John, and I wanted to make sure what's happening is that there are 5 modules. And so the quiz pulls 2 questions from a quiz bank from each module. So even if you're getting a different pathway badge the second time around, you're still getting asked the questions about the infection control, content, the health, safety prevention stuff. And then 2 questions of that next certificate you try will be specific to that digital badge and certificate that you're going for. Does that make sense? It's just questions from it's not a competency base. I see that as a question. It's just, did you understand what was in the content? So it might ask a definition. It might ask, this is a behavior that's supported, true or false, right? So they're asking quiz questions based on what they've learned. And really too, that's one of the questions that brings up is, this wasn't meant to replace actual training that an employer would do, right? This was meant to support their efforts and to get it started. And so at the minimum, they would have this, and at best, then they would be able to build on this and the practices that the students would actually see happening, or sorry, employees would see happening on the ground would match up. So it wasn't meant to be more than that baseline.
And the intent is, this is not to replace, if you're going to embed this into your training programs, your CTE or vocational training programs, this is not meant to replace any of the healthcare, allied healthcare training that they put in place. This is not meant to replace that at all. You can add this to it if you'd like.
Supplemental, right?
Really looking for those that are non-health related fields to add this as supplemental information for your students. So if you're doing a lecture, happen to be on infection control, you can actually embed this into your lecture. You can use these as part of the discussion, or you can have this as an assignment for students to go to, come back, and then build upon what they've learned in this infrastructure.
The other thing that I wanted to say about that, and this is a response, we can get to the questions now, but one of the questions is, when we first designed this, John immediately was like, how can we get this information in the hands of people who are, you're a grocery clerk. My daughter actually is at college away in a different town in California. She's a grocery clerk. She's not health trained, right? And yet she's going to have to manage this for her own safety and for her customer safety. So we did build this for the non-health worker. I also think that if people are in this, there are a lot of displaced workers right now in our sector, retail, hospitality, tourism, or RHT as we call it. If you like this stuff, we're hoping you'll be like, oh, maybe I should go into health. Maybe this might be an area I can go into that I didn't think I liked before. So there were a lot of reasons we kind of wrapped it up this way. But really, it was meant to be supplemental to any program. So let me see. And Veronica and Holly, if you could maybe help us. I can put in the chat. You have the slides, which has our contact info, and I've put in the chat our contact. Please share if you came in late. Please share your name and email, and we'll keep you posted about our upcoming changes. But we'll gladly go through the questions. I think I just grabbed a few that I saw. So Spanish coming soon. Hopefully Vietnamese coming soon. We've had that request from some of our Southern California partners. Education pathway. Oh, someone asked, what would we recommend for office staff and custodial staff? So custodial staff, I would recommend the engineering one, and then you could also take a look at the housekeeping one. It is definitely geared towards hotels. Frank Gerdman actually asked a question, did we get industry input on this? And we tried very much. We worked with the California Hotel and Lodging Association. They actually were the ones who said no more than 2 hours, and please, the more cross training we can get, the better. So absolutely, if you know of good tools or employer partners that you'd like us to talk to. Some examples we wanted to just share as well. I'll continue with questions in a second, but I almost forgot this. One of our big partners is Grocery Outlet, and they have now, they built the distribution center or warehouse worker pathway with us. Some exciting things that happen from that is that they're giving their employees a bonus for completing ICAN up to $100. Knowing that only 2 of those are for retail grocery people. They want them to get excited about training. And they've also built an educational reward sort of incentive system, which they didn't really have for the distribution center workers before. And this is what's so exciting about this little gift. They're now launching a first time supply chain internship. So this wouldn't happen if we didn't have something to offer first. So that's just one example of an employer success that we're super excited about. But we're happy to talk with you in more detail about how this can add to your programs, either with employers or with your staff as well. Because we want it to be used so much that everyone knows what this is.
I think there's a question here related to, can you move this onto your Canvas account? Yes, if you email us, we can email you the shell for access to this, and you can actually merge this into your Canvas account. This is made, through the grant funds from the community college system, so it's for you to use. The digital provider is, I believe, Badger is what we connected with on this particular project.
Let's see. I'm sorry, I'm trying to track through the questions. Are there any?
So Joy, you left off at how do you go back and get a second or third certificate or badge? Did you cover that one?
Yes. Just as a reminder, as John had said in the demo, if you go back, if you've done one, you can just log back in with your same account and go to module 4, which at the end of it, you choose which pathway, and then you can just go from there.
Mm-hmm. Okay.
And we do actually have a video coming out. I'm sorry it wasn't ready for today. It's a 60-second kind of review of slides that just explains the highlights of what we talked about here. So as soon as that's ready, again, if you're in the chat, put your email in there, we'll send that to you. And then you can also use that to explain it to people, so you don't have to have us every time, 15 minutes. Let's see, there was also a question about for office staff, which would we recommend? There is a customer service. It was built for hotel staff, but it would absolutely fit. What I can try to do is when we look at the educator pathway, some of these positions that you're mentioning in the chat, we'll see what we can do about making it specific to those needs.
There is a culinary services personnel module that might cover the culinary arts. So those of you who are in culinary arts, if you see that there's some information we can add to that, please let us know so we can definitely add that content. We do, we want to be very careful that we're not putting too much information here for people to not access it. But if you think that there's something that we can add here that adds another couple of minutes, 15 minutes or so like that for the end user, we'll be happy to work with you to put that embedded into the curriculum. Yes, please send us those if they're job aids or anything like that that you and your staff find that are really useful for your folks. Please do send it to us because it is dynamic. One other thing I mentioned, you'll see that one of the digital pathways, and here, I'll just go back to this slide since we're talking about it like everybody knows what we're talking about, but let me just go back to this share screen of the actual pathways that we had built.
Can you guys see that now?
Yes.
Okay.
Yes, we can.
So this contracted services pathway was really built based on a hotelier's, one of our hotel partners was like, hey, you know what? I don't have security guards. I don't have landscapers. I have contracted services that come in and it's a separate company. How do I know that they're going to be safe? Because I want them to have the same standards that my staff does. And so that's why we built that contracted services pathway. And it just talks about how you still have to learn all this stuff, but when you're doing your services, that you're doing them in a way that is consistent with how the rest of the employed staff is using. So that's also one thing I forgot to mention. But yeah, well, this customer service pathway was originally built for hotels, as I mentioned. Retail customer service is a little bit different. So this first one was for hotels and restaurants, but could absolutely be used for, if you think of office staff as having to serve each other and customers, that's probably the closest. And then we didn't call it food and beverage, but we called it culinary services because that way we could kind of, that's one area we all know, high emphasis on food safety and sanitation, understanding standard operating procedures, really keeping people, preventing foodborne illness. That is where they already know all that stuff. So how can we keep them aware of just the infection control pieces we know given this particular pandemic? And I guess the only thing I'll say is, as John mentioned, this is meant to be evergreen. Just like your booster you're going to get with your vaccination, like we'll refresh this, and each year, this will still be relevant. People will need to know how to keep themselves safe, whether we're in the situation we are now or not. And so we're really, really happy that you all find it valuable and can share it. That's what we're hoping, right, John? What's our target? How many people live in California? 20, and we're 26 million people have this badge. That's awesome.
I think one of the things too, we also want to make a disclaimer is that this information, it comes from the CDC and from the CDPH guidelines. However, your local health departments may mandate something completely different. So this is just the general information that's coming from all, the larger scale of CDPH and the CDC. But I do know that local health departments say something different from one department to another department. So I just want to make sure that.
Yeah, that's a good point. I think we're all seeing that. John's in Long Beach. John and Chloe are in Long Beach. I'm up north, and I just saw that LA County and Santa Barbara County and several counties have said, as of March 1st, educators, you're now in the 1B. We don't have any vaccines and there's no appointments available, but hey.
Yeah.
So the good news is hopefully we are seeing light at the end of the tunnel.
Yeah, I think there's also a suggestion for farm workers.
Yes, and food, right. There's that 1B group. Anyway, let's see, what else? Are there other questions that I'm missing?
Did you cover the question from Toybi about the final test for certification? Is it competency based?
It's just quiz based. Yeah, for this. Yep. And then let's see. Oh, there was a question for what ESL level to create this for. This is actually a question Madeline Arbayo brought up to us. And John, we might need to talk about this. We tried to gear, we're balancing what the CDC is giving us, CDPH, and the level of content that's in there with trying to make it at least, high school graduate, I guess, level is what I would say this is at. But I think we can have longer, if people are interested in talking to us about this, we would love, I feel like that would be really important for us to figure out, is there, back to this idea of the step stool to get to the ladder, maybe there's a pre-version of this that is ESL for, that even is kind of an entree into this. So this isn't so overwhelming. Anyway, John and I are happy to talk with you about it. If you're interested, if you are, put that in the chat and we'll reach out. Yeah, and then I see pathway for farm workers. Thank you. I'll add that. K-12 settings or early childhood settings. I will say our educator pathway right now, we're thinking about you all and college. However, I think if we could get support for it, I think we would, be interested if there's any, what the differences would be, to add a K-12 pathway. You should know that John and I have 2 nickels between the 2 of us. This is all put together with paper clips and a lot of passion and commitment. So if you all feel like that's important for us to focus on, we'd love your help to create the support for that. Let's see, yes, visuals. Oh yeah, and maybe for some of these conversations around the ESL, we'll definitely pull in Neil Kelly and Madeline, because we would want it to be, we would want it to be important. Okay, so now I'm seeing 2 educator pathways, us and our K-12 partners outside of this group already, that's already here. Yeah. Okay, other questions or thoughts, or the other thing we can do is open it up to ideas of how you would like to, how you're thinking, maybe share a little bit about how you're thinking. You might want to discuss, we might have time for a couple people to see if they have ideas of how they're planning to integrate this. And then I know maybe if we have a couple minutes open for that, does anyone want to share any ideas in the next few minutes before we hand it back to Veronica to close us out?
Hello, I'm Toyvi. First of all, I wanted to say thank you for such a wonderful curriculum and for willing to share it with all of us. We have an early childhood development class going on right now, and it's an 18-week program, and part of it was going to be CPR and first aid, but right now, because we cannot do that, we were in a bind, and this seems like the perfect little substitute for that. So usually in our 18 weeks program, the last 3 or 4 weeks, we save it for the CPR and the hands-on demonstration for first aid. But I just wrote to our CTE coordinator, maybe if we could use this, we have a solution finally. So yours is a 2-hour session, but for our students, because they are EL students, we're going to need to give them a lot of EL support, so we can extend it a little bit and make it into at least a 2-week program instead of just a 1 class 2 hours or 6-hour module. So thank you for sharing. We will certainly like to try that out, and if we learn anything from it, we will share with you our successes.
Fantastic.
Thank you.
Yeah, I'd love to talk with you later too, because any learnings that we can get for how it's used in a different way. Obviously, you heard how we came to it, right? It was sort of like keep businesses and employees safer. But if there's much more use for it this way, it's very exciting. Thank you for sharing that idea.
Thank you.
I just wanted to share, I put in the chat a link that the high touch soft skills curriculum that we have available to you as well. It's free to be downloaded and used. It has all the essential skills for competency, communication, workplace ethics, professionalism, team building, collaboration, demonstrating compassion, embracing diversity, effective problem solving. Those are modules that you can download and use and do those either via Zoom. We do have those integrated onto Canvas. However, we're not releasing it yet because we're having difficulties with the PowerPoint presentations for students to do, because it's kind of also, we're trying to build it also self-paced. But the curriculum is here for you to use at that. And what's nice about this curriculum is that you can contextualize it to any sector. Soft skills don't change. What the curriculum is contextualized to healthcare. So a lot of the examples and things in there are related to healthcare, but you can also use that as a means for helping out your students as well.
I'm so glad you shared that, John, because it is such a great tool, you all. It's free, it's available. I also forgot, we have all these gifts we keep forgetting about, but one of them is we built a platform. It's a case study, it's a case scenario, but it's built in animated world of a hotel and a restaurant. And it kind of is about what would you do in this situation? And so maybe I can talk with Veronica and I'll share that with you, because if anyone's interested, it provides a situation, and then you have 3 choices that you can choose. And it's really helpful for people in the, trying to build their work skills to practice this in a safe space. Again, it's built into a platform that can be embedded into whatever you're doing. And it's called What Would You Do? So if you guys are interested in that, I can walk you through a demo of that. Also built with industry input from restaurants and hotels. It's a Jetsons world, which the younger kids don't know, but we all know. So it's kind of fun. And there's a restaurant situation, a room service, customer service at the front desk situation. There's a few things that take place in the space age hotel and restaurant. So that's another one we can maybe bring you as well.
And Frank, to answer your question for the 21st century employee skills, this is not they actually saw our stuff that we did develop for the high touch and left healthcare alone because we already developed this. So.
Okay, I think then, does anyone else have any other thoughts they want to share with the group about how they are hoping to integrate this, or any other questions? Okay, then if there isn't, you all have our contact. I'll repost it. It's in the chat, and then I'm going to hand it over. John, if there are no other, Chloe was so quiet. See, I think once we acknowledged her, she just stayed quiet.
Don't jinx it.
Okay, well, thank you all so much for your time.
Thank
We
you.
really appreciate your work, and we're super excited to share this with you. Thanks, Veronica.
Thank you, Joy, and thank you, John, for today's presentation. And thank you to you all for joining us this afternoon. The webinar has been recorded and will be made available to you all once it's ready. So please just give us a few days and we'll send it out to you all. We'll also send you an evaluation. So please let John and Joy know what you thought about today's presentation, and then also indicate if there's additional information that you would like to receive at this time. I'm seeing a bunch of thank yous. So yes, thank you all very much for joining us, and we will see you all next time. Everyone have a great afternoon. And I see some contact information coming in, Joy and John. So if you guys have captured that, I can also send you a link to the chat.
Yes, please do. Don't forget, wash your hands, wear your masks.
All right, everyone have a great
And
afternoon.
get vaccinated.
Goodbye.